What do you think is the number one biohack? Is it airway-focused dentistry? Because there's a lot of biohacks out
So
there.
I will ask you, as an expert in this area, define biohacking.
It's finding something to optimize in your health, in your well-being, and finding the best way of doing something without, having medical intervention and doing it in the most healthiest way to optimize your health.
So to answer your question, no question.
Yeah.
Airway is the best.
I'm Mark Cruz. I'm an airway-focused dentist that advocates for wellness. My mission is to help you transition from disease management towards true wellness, starting with your airway. When your airway is limited in any way, it affects your sleep, your health, even your smile. We treat root cause, not just the symptoms, so that you wake up refreshed, live fully, and smile freely. Visit our website, markacruzgds.com. Breathe, sleep, and be well.
Well, welcome to the Breathe, Sleep, and Smile podcast, formerly known as Breathe, Sleep, and Be Well. Let's jump in. I think we've got a really interesting topic. Can you introduce it, Amber?
We really do, because airway and biohacking is something that I think the internet is blowing up talking about, right? And it's the most underrated performance tool that you have. So people are wearing Oura rings, they're tracking HRV, they're optimizing every variable in their sleep and performance, and they're completely ignoring in one thing that might be the undermining of it all, and that is airway.
Yeah, it's interesting. Again, I see it as a sign that the public at large is taking control more of their health. I mean, we don't have to stop there. We can also look at the glucose monitors. They're in the gym, and you see the glucose monitors people are looking at. They want to get data. Right. And they want to get data, and they want the telemetry to be able to make better decisions for their health, and I think that's great. Yeah. We could talk a little bit about each one of these, and maybe I can add one, but like heart rate variability is definitely a marker for wellness. So you want to have a wide range of heart rate variability, meaning that your heart and autonomic nervous system is healthy enough to meet a stress challenge. So you want to have a relatively low heart rate that's efficient, but that if you needed a moment's notice to be Johnny on the spot, to run away from that cave bear, if you will, it can jump up very, very high. And the thing about sleep disordered breathing in its end stage, like obstructive sleep apnea, it decreases heart rate variability. So essentially, that individual is not so well. They're more sick. So heart rate variability is a way of finding out how healthy am I. Oximetry, we know oximetry is as a way of also checking your gas exchange, your efficiency of oxygen. We talked about glucose monitoring. One that people aren't really talking too much about is capnometry, is CO2. In fact, this morning I was on a Zoom call with my good friend Peter Litchfield, who's a world-renowned researcher in this space on capnometry, which is a lead in sleep studies looking at your gas, the CO2 exchange. It's a byproduct, it's a waste byproduct, and super important as a marker. In fact, the anesthesiologist will monitor end-tidal CO2 when a patient's under general anesthesia even more carefully than oximetry. It's super important because it's a moment-to-moment marker, if you will. So I see the public really starting to learn about this, but what Peter was saying this morning was that it is really huge in esports. So esports is the largest sporting domain of all sports. It's huge, and a lot of people don't know about it. But you'll have these gamers that will have a tournament where the purse is like $150 million. Right. And you get from all over the world these gamers that will be playing a game in their headsets, and they're highly paid. And the difference between who wins and who loses are measured in milliseconds. And so while I was on this call with Dr. Litchfield, he actually received a call from the health minister at the UK that's very interested in looking at the use of capnometry, which he has it now as a wearable that you can actually monitor how you're breathing.
Okay.
And but what they did with these gamers in their studies to actually show that when you're gaming, which is a very, very stressful, in any sports that's competitive, it's stressful. And the difference in your performance is how well you're able to monitor your breathing,
Right.
not overventilating. Because when you overventilate, it stimulates a stress response, and then your muscles don't function quite as well, ironically. And so what they're able to do is they're able to monitor the CO2 levels where your finger movement on the keyboard or the mouse, the difference between having a really good end-tidal CO2 and one that's a little bit off can be 350 milliseconds, which is the difference between winning the tournament or not. And so they're all in right now. Peter also has very, very big contracts with the Department of Defense, looking at jet pilots, looking at performance, so looking at CIA agents and FBI agents that are in stressful situations that are making decisions in nanoseconds, all based on how you're breathing. So, okay, we may not be in that domain, but I still want to be ventilating as optimally as possible. So during the day when you're feeling a little bit anxious, I'll suggest that maybe you're overventilating. You're breathing too much. You're blowing off too much CO2. And maybe you kind of slow that down because it's affecting your blood chemistry, your blood pH. Okay. And so you start becoming more symptomatic. So these are all things that the public is starting to understand for performance on a day-to-day basis, is using these wearables, the Aura rings, on their sleep. It's great.
That's what I was seeing here. I had a question down for you, that if someone is wearing an Aura ring and seeing poor sleep scores or low HRV, they've tried everything, what should they actually be looking at first?
I always say jokingly, and yet not so jokingly, but it makes the point, measure twice, cut once. Another way of saying is gather a lot of data before you make that decision. Right. And so I think we do that, and again, something that we get into in depth in setting up our clinical practices in airway is get that quantitative data by measuring and let it tell you what's going on versus just a subjective report that is important, but still nonetheless you want to have that data. And so I think having some form of data to kind of give you some insight. So the Aura rings, patients are coming in now and they're looking at their sleep efficiency and they're saying, you started doing this treatment on me and I could just tell you, I'm getting these reports that my sleep efficiency is improving. My heart rate at night now is dropping down to 50 beats per minute, whereas before it was always around 70, 80. And it kind of explains a little bit about how I feel. So I say, well, that's exciting. It's consumer level. Right. I'm not going to have you make any decisions on that. But it does give you a little bit of insight of something that we're measuring. Yeah. So
I'm thinking now, if the fact that my kid wakes me up multiple times a day or multiple times through the night, does that mean that my sleep is affected? Am I going into those deep sleeps, as much as I should be? If you're a parent and you're being woken up through the night?
Well, that's a problem. First, on two domains. One for your child and the other for you. Right. So as a mom, I would say, why? Yeah. Because if you start
I would say habit.
Well, maybe it's a habit, but not really, because when you sleep, we're meant to sleep all the way through the night, especially during a critical time of growth and development, because, again, the hypothalamus in the brain releases the metabolic hormones, glucagon, insulin, growth hormone, the sex hormones, 3 to 5 times a night in spurts of 7 to 9 minutes during deep, deep sleep. If you're not getting that, then it will affect growth, metabolic function. We know that fragmented sleep will also affect IQ. There are neurocognitive correlates. So for your child, I would ask that question. That should not happen. Right. For yourself, it's also affecting you. Really not that different than having a spouse that snores. Your sleep quality is affected. So I'll just cite the Thompson study was the first study to actually show a dose response in women in acquiring the risk of breast cancer based on sleep quantity and quality. So the less sleep you have and the poor quality of sleep, the greater linearly the risk was for expressing an oncogene, having cancer, breast cancer. So not like this loose association, actual causation. So those are kind of some things where nature would not invest a third of our life in a state that we call sleep unless it was super important. Now, the fact that we don't know that much about it, and we're learning more about it, doesn't change that nature knows what she's doing. And so I would be very careful and say why. Now, if you're on vacation or it's a short stint because the kid is sick or you're sick, a week or 2 weeks, okay, fine.
Yeah, but if it's every night or
If
every
it's
other
every
night,
night, it is, we worry about going to the gym and eating right and doing all these things. We also should be concerned about our sleep
100%.
and importantly, asking the question about our breathing.
Right.
So,
Okay. So let's transition a little bit
Sure.
about mouth taping.
okay.
Okay, so mouth taping is everywhere right now. Huberman talks about nasal breathing constantly, and you had mentioned on the last podcast about keeping your mouth closed and actually breathing through your nose 90% of the time
Yes.
is what we're supposed to be doing. So what does an airway dentist actually think about that trend when it comes to mouth taping?
Yeah, it's funny. Well, when I was talking about mouth taping back 15 years ago, people thought I was crazy. At the time, I was using like medical tape, Scotch tape, things like that. There were very few of us that were really talking about it, but it was kind of a crazy idea. And now you've got companies and podcasters and influencers that are talking about KT tape for the lips or for the mouth and all these alternatives, even like for the nose and to dilate the nose. It's crazy. I had colleagues that were really upset that I was talking about what's the science about that. And yet I was actually involved in an IRB, Institutional Review Board, clinical trial that I was asked to help in at a Northwestern in Chicago many, many years ago. And one of the primary investigators, was an ENT, and we were doing this design. And one of the things I said is, well, we should have a group taping and not taping. And he said, yeah, that makes a lot of sense. And so we know now that the reason for that is, I said in another podcast, is that all mammals exchange gas through the nose. Why is that? Well, when you're breathing through the nose, you are purifying the air through nitric oxide that is only produced when you're breathing through the nose. It's a transient signaling molecule that affects the entire endothelial system or cardiovasculature of the body. The three physicians and physiologists that won the Nobel Prize some years ago was for discovering this transient signaling molecule. It also kills viruses and bacteria. So it helps to sterilize the air. It brings it up to body temperature. It humidifies it. It conditions it before it goes into the lungs, which is super important, and then it optimizes it. So your blood pressure, your heart function, your whole vasculature is affected differently when you're mouth breathing than when you're nose breathing. Any athlete is going to be breathing through their nose during stressful times for having their optimum function. It's not to say that they're not sucking wind, mouth breathing some, but it's very, very important that we breathe through our nose. So I hope that addresses that.
I think it did. I mean, when I think of mouth taping, you're literally just like taping your mouth, and that's how they're going to sleep, right?
Yeah, I'm concerned about that for a couple of reasons. Is I always used it as a diagnostic tool.
Right.
It was never really meant to be the end game. That you'd have a product that you would depend on. It was to give you an insight as to what's going on. No different than a breathe right. Anyone's ever used a breathe right. Athletes use it just to get a little bit better flow through their nose. Right. Their performance is better, less stress. But when you mouth breathe, if you have a deviated septum or congestion and you're a kid, you're going to freak out when you are trying to sleep. So yeah. I always say, be careful, do it during the day, see how they are, make sure that they're breathing through the nose very, very well. And ironically, mouth breathing also fosters nasal congestion. Yeah. So I think that it is something that, for me, how I used it was to kind of give insight. Another thing that I do now more for like a kid is I'll do the 2-minute test. Can they sit still for 2 minutes, keeping their lips together? So they're in there, and in front of mom, we'll do that. Let's see if you could do it. Put on the timer. And if they can't, they open constantly. No, close them out. They can't. They start becoming fidgety. You start seeing the stress. That's a problem. You don't want to tape that person. Yeah. And so if they're doing that, there's flow limitation at some level that maybe is not that detectable moment to moment, but when you start doing that test, mouth taping can do the same thing. Now, if they could do that, no problem, then that's great. They're breathing the way they're supposed to, and then they shouldn't need the mouth tape. You shouldn't need the mouth tape if you have myofunctional, if you have good myofunction, meaning that the lip muscles, cheek muscles, the oral posture is functioning properly with good strength. And that's where myofunctional therapy comes in, is you have lip competence. It's one of what we call the 5 competences, which is nasal breathing always, lips together, tongue on the roof of the mouth, non-collapsing pharynx during sleep, and diaphragmatic breathing. Those are competences that all of us should do easily, have no problem. When any one of those are perturbed or there's a problem, then you're going to have a compensation, of which mouth breathing is just one of them.
Okay, all right. So there is a growing conversation about how jaw alignment and bite affects not just your sleep, but also cognitive performance, stress response, even athletic recovery. You were talking about how athletes, will breathe through their nose in a stressful situation. So kind of walk me through that connection between the jaw alignment and how bite is affected when it comes to your sleep.
Yeah, no doubt about it. It's kind of the same thing. Form follows function. The way our faces, our facial skeleton from when we're born all the way through growth and development is supposed to grow is downward and forward. But oftentimes what's happening in our population now, and we talked about anthropology in another podcast, is that we're getting a vector more vertical growth at the expense of that forward vector. So as the midface grows forward, the caliber of the airway also gets bigger and optimized. So you have a forward and downward, as Dr. Donald Enlow, who's considered the grandfather, if you will, of craniofacial biology or craniofacial growth and development, did a lot of research. He's got a famous saying that the airway is the keystone for the face, meaning that it's really the breathing through the airway that portends to proper growth and development. So the airway gets optimized in growth and development by the face because the face has this big functional space called the airway. That's what's interesting, is that the airway is not an organ, and we tend to focus on organs. It's actually a functional space. It's the space that allows us to exchange gas, the most important moment-to-moment function of any mammal, and it's defined by everything that's around it. So how our face grows will change the shape of and size and function of that face.
What would be the single intervention that makes the biggest difference for someone who has no diagnosed sleep disorder, but just isn't performing at their best and doesn't really know that airway might actually be the reason why?
Yeah, because it can be nuanced, and you're listening to different podcasts and you're saying, I wonder if I can be doing better. Or the opposite is, I'm doing great, I have no problem.
Right.
They just may be high functioning, and they're well within their adaptive capacity. So it's like there's a lot to talk about there. But I would say, again, measure twice, cut once. Let's get data. Let's find out. And that's what we do with an airway-focused approach in practice. Is there is a battery of questions that look at 5 of the 7 organ systems. So dentists are licensed to look at 5 of the 7 organ systems. Physicians will look at all 7. And we would look at those and look at the signs and the symptoms. And then we also do our clinical photography that gives us what we call the phenotype. They're markers for how the face is developed. And then, of course, we've got quantitative data. We talked about wearables, but there are also medical grade metrics to look at quantitatively how we're breathing. And then at that point, you could see that there may be some issues there. So I recently had a patient that was asking about that, didn't report anything except for she couldn't get pregnant. there was a fertility issue. And OBGYN couldn't figure out what was going on, but everything was checked out. Everything was working properly with her and her husband. And so we started talking about that. And I could just say that a mammal will not want to get pregnant if it's in an upregulated sympathetic drive, even if it's low grade, which is what a lot of us are under. We might blame the traffic, our boss, our spouse, our to-do list as to that low-grade stress. It may not be a stress level like you're being chased by a cave bear,
Right. Yep.
but it's still low grade. It's telling in the background the body to say it is not time to get pregnant. Mm-hmm. So you won't be able to. It does affect fertility, and we can dedicate a whole podcast just on that. The other side of that, too, is that you can't regulate metabolically. So when the autonomic nervous system is telling the brain metabolically that you're stressed, it's saying hold on to fat. Right. So no amount of dieting is really going to change that because you're regulating incorrectly, and so a lot of these background functions are affected by that. We were just talking about someone who looks perfectly healthy, what I call skinny woman syndrome. A young to middle-aged female that looks like the vision of health is a good BMI, and yet sometimes they're the most symptomatic patients, ironically, because they're very healthy. Right. They're very symptomatic because they're very healthy, because their autonomic nervous system is screaming at them, telling them, I've got problems, but they go into our disease management healthcare system, and it's a pill, chill pill, it's an antidepressant. It's, whatever the intervention is pharmaceutically, and yet they have a sense of what's going on. And again, fertility is just one of them.
Just one.
Yeah.
It's funny when you had said that. I was on another doctor's podcast, and we were talking about biohack in the dental space with Dr. David Elfie. Mm-hmm. And we were walking the streets of downtown Houston, and he was saying how in that particular area was one of the largest medical areas in all of the U.S., and just how much billions and billions of dollars are put into, into treating and prescriptions and all of that. And it really came down to understanding your sleep patterns and your airway, that could actually wipe out like 70% of all these medical, when you're saying about take a pill for this, take a pill for that, right down to people who go to bed and they snore their whole life and they just think it's normal, right?
Yes.
I'm just a snorer, I'm a deep sleeper, when actually it could be just a sleep pattern. They could have, their jaw open, or they could have some sort of surgery to open up their airway, and all of a sudden they're sleeping better, and then all those symptoms just kind of disappear, right? I got no more tension in my neck. I've got no more stress. I'm not feeling anxious.
Yes. Yeah. Absolutely. Yeah. I say it's the nexus of health. That's why we have that other podcast called the Airway Nexus. It's the foundation. And it gets overlooked because it's so obvious. I'm breathing, right? I'm breathing. I'm exchanging gas, as if being on a ventilator, breathing, is the same as yoga breathing. They're not the same. It's all that goes along with it. How efficient is it? And that's what really is causing chronic disease in our population that did not occur just even decades ago at the levels that they are. I mean, RFK is talking about, when his uncle was in office, that, they never had all these problems as a kid, as obesity. Our kids are sicker and sicker. Yeah. And we're spending more and more, and we're missing the elephant in the room. Mm-hmm. And can it be that simple? Yes, it will be, because you have to understand how a mammal is supposed to function optimally. Now, the fact that you can work around and do all these other and supplement and do all this, fine. But it's not really intentional as it pertains to healthcare as to how we should be functioning. And I applaud the fact that we are looking at petroleum-based products in our food. Yeah, that's not good. It's inflammatory. But I'm just going to argue that the food is not the problem. It is part of the problem, but it's not the fire. It's the fuel. Yeah. The fire is all the stuff that we're talking about, and the evidence is super clear. It's just that because we're so siloed and specialized, we kind of lose that global view. And that's what this podcast is about. That's what being an airway-focused dentist is about, is kind of stepping back and looking at and putting together a picture that really makes more sense we're incentivized to learn more and more about less and less.
Yeah.
And you get paid more if you're more specialized. But, you lose your way when you know more and more about less and less. My partner, Barry, and I talk about, teaching partner that we teach, talk about don't be a barker, meaning like you're looking at the forest and you could see the whole entire forest, but we're looking at the bark of one tree as if that's, we know everything about the bark in that part of that tree, but we know nothing about the forest.
Yeah.
And so I think in healthcare, it kind of stands the same, if that makes sense.
I want to leave you off with this at the end of this podcast. What do you think is the number one biohack? Is it airway-focused dentistry? Because there's a lot of biohacks out there.
So I will ask you, as an expert in this area, define biohacking.
It's finding something to optimize in your health, in your well-being, and finding the best way of doing something without, having medical intervention and doing it in the most healthiest way to optimize your body.
So to answer your question, no question.
Yeah.
Airway is the best, but it's complex.
Yeah.
You can't go ahead and take a weekend course on some widget and say that you're doing airway and the patient's better. First of all, you're probably not measuring anything that's of meaning to the patient. So I think, again, we've got to be careful because it's complex. But that's the number one thing, I think, and in the future that we should be really looking at is that very, very basic moment-to-moment function of breathing, optimizing it. And you really don't know what that is just by breathing. Yoga breathing is not airway. Right. It's an effortful way of doing something that we should be doing naturally, competently. MHOF breathing, all these different types of cold plunges, all these things people talk about, you can show that there's a health benefit. You might call it a biohack, but it's to address something that you're not doing very well that you should be doing competently. Yeah. And so I'd love to talk more and more about this specific topic because I know there are other podcasters, well-recognized podcasters that talk about it. And I think that's really interesting. But I think, again, you're missing the elephant in the room. Again, it's because of our siloed healthcare system. But I'll leave it at that.
Yeah. We have so much more to talk about,
yes.
Dr. Cruz.
Yeah. Thank you. I'm excited.
Yes. I'll see you on the next episode.
Sounds good. Take care. Bye-bye.
Bye.